Welcome everybody to MoRat Nation. I'm Bob Carmichael and let's get started. To begin with, I should mention that I am not a doctor, and these are my personal views and are not intended as medical advice. Essential tremor, Parkinson's disease, and atrial fibrillation. I believe in many ways these three conditions are really the same condition in different parts of the body. In all three cases, senescent cells begin to misfire, causing tremors. In all three cases, one of the most successful treatments involves ablation, where these senescent cells are destroyed. In none of these diseases does ablation cure or improve that part of the disease that does not involve tremor. Essential tremor. Essential tremor involves, for the most part, shaking of the hands, either both right and left hand, or both hands. Essential tremor can also involve other parts of the body, such as your legs or your tongue. For most of my life, ET was viewed as harmless shaking, but I can guarantee you it is not harmless. Anyone who has ever tried to type or write a letter with essential tremor knows what a debilitating condition this can be. Essential tremor is the most common neurological condition among people over 50. My grandmother had ET when I was young, so when I noticed the first signs in my late 40s, I didn't panic. I tried a large number of herbs and supplements that were marketed as cures for essential tremor. None of them did anything but cost me a lot of money. A common beta blocker called propranolol gives many people some relief, but has many unpleasant side effects. So many years ago, I began reading about using high-tech devices to treat my essential tremor. The first device I investigated was called Gamma Knife. The doctor in charge told me that this type of procedure used gamma radiation to burn a hole in my brain to kill the misfiring cells. The doctor told me that this type of procedure was not focused enough to avoid damage to other parts of my brain. That was when the doctor told me about focused ultrasound and the remarkable success they were having in clinical trials. I immediately began searching for hospitals that were doing this trial. When the trials were finished, I tried to sign up and have the procedure done, but it was a full year before Medicare would pay for it. I could pay for it myself, $30,000, if I didn't want to wait. Also, I learned from the doctor that he was only willing to do one side of my brain, and that people who had both sides experienced problems with their tongue. The doctor saw the disappointment on my face and mentioned that deep brain stimulation involving surgery and implantation of a device in my brain could be used to treat both sides of my brain. But this type of risky surgery was not something I was interested in. The ablation procedure itself involves using focused MRI to pinpoint misfiring cells along the thalamus on both sides of my brain. At no point in this process did anyone mention any other possible way of treating this condition, such as megadose of thiamine. Parkinson's disease. Parkinson's disease is caused when cells in the brain that produce dopamine stop working or die. The usual first treatment for Parkinson's disease usually involves levodopa or some other similar drug that increases dopamine. As the condition continues to deteriorate, new and different drugs and treatments are needed. In recent years, deep brain stimulation and focused MRI are successfully used to deal with motor symptoms of Parkinson's disease, but unfortunately, they have no effect on the non-motor portions of the disease, and they do not prevent the disease from continuing to deteriorate. When I was looking for a non-surgical way to improve my essential tremor, I came across this study by Dr. Antonio Constantini. In the study, he talked about the improvements he was able to achieve with high-dose thiamine injected twice a week. The thing that surprised me the most was that he was able to achieve this progress while also improving the long-term outcome of the disease. Atrial fibrillation. The heart's electrical system keeps it in rhythm and tells the heart how hard to beat. In AFib, some of the cells in the upper left ventricle begin to send out extra beats that throw the heart out of rhythm. In other words, the heart develops a tremor, similar to what you see in essential tremor and Parkinson's disease. The first way to address this problem is by using drugs. Beta blockers like metoprolol are used to keep the heart from beating out of control. Antiarrhythmic drugs like flecainide help restore rhythm. Usually a blood thinner drug is added to help prevent strokes. Then the cardiologist uses a procedure called cardioversion, which involves shocking your heart back into rhythm. The usual way of doing this is to start off with a beta blocker like metoprolol and see if that will hold you in rhythm after your cardioversion treatment. If it does not, then flecainide is added. They do it this way because of all the side effects that these drugs have. I can tell you from personal experience, I did not ever feel good during this period when I used these drugs. The next thing that doctors try when cardioversion doesn't give acceptable results is catheter ablation. Catheter ablation involves running a catheter up your groin into the upper right ventricle of your heart and then over to your left ventricle where most of these cells are usually found. These areas are usually tiny and destroying them does not affect the heart's ability to do its job. When I discussed all of these options with my doctor, he told me that I would probably be on drugs for the rest of my life for AFib. He did not mention to me at that time that some cardiologists were trying to wean their patients off of these drugs with a combination of exercise, diet, and supplements. One of these doctors is Dr. Eric Morales, or as he is known on YouTube, Dr. AFib. Dr. Morales teaches an online course for $100 that talks about the best diet, exercise, and supplements to naturally control AFib. I did not use Dr. Morales' course, but I did lose weight, exercise, and maintain a healthy diet while taking many supplements. I wish I had known about his program before doing this on my own. I worked with my doctor about the best way to get off of my beta blockers and my antiarrhythmic drugs. I wore a heart monitor for 2 weeks. I did decide to continue taking my blood thinner medication, Eliquis, for a few months after I stopped my other medications. I continued to take Eliquis because my doctor gave me a CHADS questionnaire to determine whether I was at high risk for a stroke. But now that I look at the questionnaire a little more carefully, I notice that it encourages all people over the age of 75 to be on anticoagulant medications. So why do the questionnaire? It was the success with my AFib problem that gave me the confidence to try to look for a way to treat my essential tremor that fixes the problem rather than just treating the symptoms. Please don't get me wrong. I think ablation therapy and all of the wonderful new drugs now available on the market have really helped a lot of people. But they really don't stop the progression of the disease. That's why I'm taking a different approach. I am presently experimenting with Buchamine, and I think I'm starting to see some good results. It's too soon to report on this, but when I'm finished, I'll do a video and include it in the playlist about essential tremor. Senescent cells. So much of the work these days concerning aging focuses on killing senescent cells. I don't think this is a good idea. I think getting rid of cells that are causing a problem is a good approach, but only to a point. It seems to me that we are using the same approach that has failed us with cancer, that is, chemotherapy drugs. One of the best-known Synolytics that the anti-aging community is excited about is dasatinib, which is usually used in conjunction with high doses of quercetin. Whenever we use today's versions of senolytic drugs, we kill a large number of good cells while we are trying to kill the bad cells, the senescent cells. Dr. Google tells us that dasatinib can cause heart rhythm problems. I'm sure as work goes on, new and better versions of these drugs will be much more selective, but is this the right way for us to go? Wouldn't it be better for us to jump over this way of dealing with senescent cells and go right to the supplements, drugs, and therapies that rejuvenate these so-called zombie cells. Many of these cells have been shown in studies to be easily rejuvenated when given the right environment. Convoy Labs, in a recent study, showed that just by using a therapy called therapeutic plasma exchange, that many of the so-called zombie cells could be brought back to normal. Rapamycin, in a recent study, was shown to rejuvenate so-called zombie cells as long as the drug was taken. But more to the point, how are senolytic drugs ever going to only target senescent cells in certain parts of the body, like dopamine areas of our brain or the left atrium of our hearts? I just don't think this approach can happen quickly enough to do me any good. I presently use testosterone so that I can donate blood 6 times a year. I explain this in my video, Testosterone for Zombie Cells. But besides that, I don't plan any additional steps to get rid of senescent cells. I think that rejuvenating cells makes more sense than just killing cells. I've done 3 other videos about essential tremor, and you can find them all in a playlist on my channel. So please hit the subscribe button and join the nation. I have no financial ties with any of the products mentioned in this video. And thanks for watching.